Hello, my name is Rochi. I'm going to be doing a neurological vascular assessment skills video for you today. So the first thing we're going to want to do, we're going to want to verify our physician's orders to make sure this is the correct procedure that we'll be doing for our patient today. The next thing we'll be doing, we'll be going to the patient's room. We're going to knock on the door. We'll do hand hygiene. We will provide patient privacy, and then we will next introduce ourselves to the patient. Hello, my name is Rochi. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Connie, April 15, 1945.
Okay. Once we've asked the patient that, we can also check the patient's armbands, which will be our second patient identifier. So the next thing we're going to want to do after we have done that, we're going to want to explain what we'll be doing for our patient, which is the neurological vascular assessment. So we'll be telling our patient that it is to evaluate the nervous system to make sure that it is still intact and functioning appropriately. So one of the ways we'll be doing it, the first thing we're going to do is the sensory response to superficial touch and pain. And for that assessment, we'll be using a pencil. So I have a pointy end and a dull end, which is the eraser. So I'm going to ask the patient to close her eyes. Close your eyes, and then I'm going to touch your arm on both sides. So we'll be doing the right side first. So tell me, is this sharp or dull?
Sharp. Dull.
Okay, we'll do the other side.
Sharp. Dull.
Okay. So now that we've done that, that's appropriate for the patient, so that's a good sign. The next thing we're going to want to do is the perception of position. So we'll be doing that with my patient's hands here. We'll be doing this also bilaterally. So again, I'll have the patient close their eyes. And then you tell me, I'm going to move one of your fingers. You tell me if it's going up or down.
Up. Down. Down. Up.
Okay. And the next thing we're going to want to do is we're going to assess for the patient's ability to identify a familiar object. Can you please close your eyes? I'm going to take your hand, and I'll put this in your hand and close your hand and tell me what it is.
Pencil.
Okay. So the patient correctly identified this as a pencil, so that's also a good sign. The next thing we're going to want to do is we're going to assess the patient's ability to identify either a letter or a number being drawn in the patient's hand. And we'll be also doing this bilaterally. So let the patient close her eyes. I'm going to draw a letter in your palm of your hand. You tell me what it is, okay?
C. C.
Okay. So the patient has correctly identified that I did write a C in the patient's palm, so that's a good sign. The next thing we're going to want to do is I'm going to assess the ability to identify where I've touched on the patient. So I'll have the patient close their eyes, and then you're going to tell, when I touch your arm or any part of your body, you tell me where exactly I'm touching.
In my arm.
What side?
Right. On my wrist. Right. My wrist. Left. My arm. Left. My knee. Right. My knee. Left.
Okay. So the patient has correctly identified all the parts that I touched, so that is good. Also another good sign. The next thing we're going to be doing is the deep tendon reflex, which will assess the biceps and the patellar. So the first thing we're going to do is the biceps. So we'll feel for the biceps tendon here, and with our reflex hammer, we'll be using the pointy side, and we'll test for reflex here. Okay. Good reflex there. Okay, good reflex there. Next thing we want to do is our patellar. We'll be using the straight edge So the patient's deep tendon reflexes are appropriate. So the next thing we're going to be doing is the plantar reflex. So we don't want a positive plantar reflex sign would be a Babinski, which we do not want. So if the patient, when we do this, we'll be touching the patient's the top of the leg. So we want the toes to curl in and not fan out, which is the positive Babinski. So okay. So the patient's toes curled in, so that is a good sign. And then the next thing we're going to do is we'll test for ankle clonus. So, okay, just relax your leg. Okay, I want to dorsiflex the foot and then just let it drop. Just let the foot drop and let go. Okay, so if the patient was positive for clonus, you would see kind of a jerking action back and forth. As I let go of it, it would have been doing like this. So, but that did not happen. So the patient is negative for clonus. So the next thing we're going to want to test is cerebellar function and proprioception. So we're going to have the patient do. We'll have them take their heel, and with their heel they'll touch the top of their knee and go down. So let's start it this way. Okay, and we'll do the same thing for that leg. Okay, so the patient was able to do that, so that's also a good sign. The next thing we're going to want to do is evaluate for coordination and fine motor reflexes. So what we'll have the patient do, we'll have the patient touch their nose and then touch their nose and point out to the left side. And then what we'll have them do, we'll have them alternate like that. But we'll have them close their eyes while they do that. Okay. Okay. Good. Close your eyes. Okay. Close your eyes. Keep your eyes closed. Okay, can you do it a little faster? Close your eyes. Okay. A little faster. Okay. So the patient was able to do that, so that's a good sign. The next thing we're going to want to do also is have the patient stand up. Okay, we'll have the patient march in place. March in place. Okay. So the next thing we're going to be doing, we'll be doing the Romberg test, which is a test to assess balance of our patient. The most important thing with doing the Romberg test is to ensure patient safety. So we want to be close to our patient, have our hand on both sides of the patient, so that will prevent them from swaying, if ever, when their eyes are closed, so that will prevent falls and injury. So we'll have them close their eyes. So we'll be doing this for 60 seconds. Okay, you can open your eyes now. So the next thing we'll be doing will be assessing for gait. So we'll have the patient walk here in the area, and what we're going to be doing will be, like I said, assessing for gait and posture, as well as rhythm and stride of our movements. So I'll have you walk over here and back towards me. Okay. So that concludes our test. Thank you very much.